Then the last topic in cell injury will be cellular aging. So cellular aging, again here it was asked in the recent NEET pattern. So what happens in cellular aging is whenever there is a cell injury, there is going to be damage in the cell. So with time, this damage is getting accumulated over time, and that will result in the decreased function and vitality of the cell. So literally, the decreased function and vitality of the cell as a result of cell injury is termed as cellular aging. So with when people are becoming elderly, so as the age advances, the amount of cell injury they must have accumulated over the years is also going to increase. So that is how patients age actually. The cells age, and that is why the patients age. So what are the factors which lead cellular aging? So for starting with DNA damage, then cellular senescence, then defective protein homeostasis, that is the folding of the proteins, then dysregulated nutrient sensing. All of these factors contribute to cellular aging. So in DNA damage, whenever there is cell injury, obviously free radicals are being produced. So free radicals will damage the DNA. So with time, if the repair is not happening properly, this accumulated DNA damage can either result in mutations, or it will cause stress on the cell and cause cell death. So the most common cause of cellular injury being implicated is, the accepted theory for cellular injury is also free radical injury. Okay. So there are certain causes in which there is premature aging. So I mentioned here that if the DNA is not repaired properly, the cell will undergo death. So if there is a defect in the DNA repair, that can result in premature aging. So starting with Werner syndrome. So remember, it is an N and not M. So Werner syndrome is M for M, which is men syndrome 1. So men 1 syndrome is called as Werner syndrome, but Werner syndrome, which is N here, is going to cause an adult progeria syndrome. Okay, progeria means aging which is premature to their age. So premature aging is called as progeria. So adult progeria syndrome, so the patients usually are in early 20s, and here the defect is going to be in a DNA helicase enzyme. So the DNA helicase is involved in the DNA replication and duplication. It is a unwinding enzyme, right? So in the gene which is responsible for it is WRN. So Werner. So Werner gene is going to be defective in this Werner syndrome. So DNA helicase is affected. So DNA repair will not happen properly. The next syndrome will be Hutchinson-Gilford syndrome. So Hutchinson-Gilford syndrome, here again a lamin A, which is a nuclear protein, is going to be defective. So it is encoded by the gene LMNA, lamin A. So it is going to form the nuclear envelope. So it is going to form a scaffold for the nuclear envelope, and when this is defective, it is going to lead to progeria of the childhood. So the patient usually presents in late infancy, and they look like an elderly grandfather. So this disease is also called as Benjamin Button disease. Then you have a Cockayne syndrome. So Cockayne syndrome, here again the defect is going to be in a excision repair gene, which is ERCC6 and 8 defect, and here the patients will be presenting in early infancy itself. Okay, so these are premature aging syndromes in which there is DNA repair defect. So the next mechanism for cellular aging was cellular senescence. So why do cells age? So one thing is a telomere attrition. So loss of telomeres. So what are telomeres actually? These are repeat sequences of TTA GGG sequences which are present at the tip of the chromosome. So at the tip of the chromosome, if you see, there is going to be this repeat sequences of TTA, GGG, and these are called as telomeres. So with every cell division, this telomeres is going to be lost. And this loss of telomeres are going to be prevented by the telomerase. So telomerase usually prevents loss of telomeres. But this telomerase enzyme is not active in the adult, the somatic cells. So only in the germ cells, and some amount of telomerase activity is preserved in the stem cells also. So normally in somatic cells, there is not going to be any telomerase activity. So there is no one to stop the loss of this telomeres. So as and when the telomeres are getting lost with each cell division, the cell will undergo cellular senescence. So after a particular point of time, the cells cannot divide. So this limit after which the cell cannot divide is called as 60 to 70 cell divisions. So 60 to 70 cell divisions after which telomeres undergo attrition. So this limit is called as Hayflick limit or replicative senescence. Okay, 60 to 70 cell divisions after which the cell will not undergo division. That will result in cellular senescence. So this graph can also be asked. So this compares the telomere length with the cell division. So germ cells have the maximum telomerase activity and they have a linear line. When stem cells have some amount of reduced telomerase activity, so it is represented as a downward arrow. But in somatic cells, we don't have telomerase activity. But cancer cells can reacquire the property of telomerase. So telomerase reactivation will be seen in the cancer cells, and there again the cells can become immortal. So telomerase is actually called as the immortality gene or enzyme. So immortality gene or enzyme is telomerase. The third mechanism for cellular aging will be defect in the protein homeostasis. So when the proteins are being misfolded, it will either undergo degradation or it will undergo apoptosis. It will cause accumulation, right? Intracellular accumulation of misfolded proteins will result in apoptosis. So the cell is going to die. That again is resulting in the cellular aging. Then dysregulated nutrient sensing. So this was the question which was asked. Caloric restriction by 30% is going to increase the longevity of the patient. So if you restrict your normal calorie intake by 30%, you can live for a longer time. So how does this happen? It happens by two mechanisms. Firstly, it will reduce the IGF-1 signaling. So IGF-1 is insulin growth factor signaling. So insulin growth factor is going to act like growth hormone. So it will lead to an anabolic state of the body. So whenever there is an anabolic state, there is going to be lots of cell growth, cell replication and metabolism. So when each of this happens, what will happen with cell growth and replication? There can be accumulation of mutations. And also with metabolism, there can be lots of free radical production. So whenever you eat lots, it is going to cause all of this free radical generation. Free radical generation was the most accepted theory for cellular aging, right? So with free radical formation, the cells will undergo aging. But there are certain proteins called as sirtuins. These are nothing but protein deacetylases. These are enzymes called as protein deacetylases. So these are present in grapes and red wine, and that is why drinking red wine for a minimal quantity on a daily basis is going to increase the longevity of the patients. So now these sirtuins actually inhibit the metabolic activity. So free radicals are not being produced and they cause the proper folding of the proteins. So when proteins are folded properly, apoptosis will not be there. So decreasing the apoptosis. And whatever free radicals were found will be oxidized. So sorry, it will be taken up by the antioxidants. So sirtuins and grapes and red wine have lots of antioxidants. So counteracting the free radicals will be there done by the sirtuins. Then it will also cause DNA repair. So DNA repair is getting activated, preventing mutations. Also, it will increase the insulin sensitivity of the patients, and that is why it is used in diabetes mellitus also. So in cancer and diabetes mellitus, they are doing research to increase this sirtuins. So sirtuins are actually helpful, and if you see in sages who are doing penance for a long time, they don't eat anything, right? But they still survive and they are quite healthy also because their bodies contain lots of sirtuins and they inhibit the metabolic activity.